Most people are never told this during a typical medical visit that lasts around 12 minutes. Two individuals can consume an identical bowl of lentil soup in the evening, yet by the following morning, one may see their fasting glucose drop by 20 to 30 points. The other person might experience almost no change at all. The food is identical, but the outcome is not. The explanation is not simply about the lentils. It depends heavily on what was eaten before that meal, how the timing of meals is arranged, and even small additions that are often ignored. The speaker introduces himself as Dr. Franklin and begins by focusing on one central hormone, insulin. He describes it as a kind of delivery mechanism. Glucose circulating in the bloodstream is compared to cargo that needs to enter storage areas inside muscle and fat tissue. Insulin functions like a key that unlocks those storage spaces. When this system is repeatedly stressed over time, the lock mechanism becomes worn. The key still fits, but the turning action becomes inefficient. As a result, glucose begins to accumulate in the bloodstream. The pancreas responds by producing larger amounts of insulin in an attempt to force the process to work. This condition is known as insulin resistance, and it is presented as the primary driver behind elevated fasting blood sugar rather than simply overeating sugar in a general sense. From this perspective, every strategy discussed serves one of three purposes. It may slow the entry of glucose so it does not arrive in large bursts. It may help improve how responsive the system is, or it may reduce internal stress so the process can function more smoothly. The speaker also addresses why strict carbohydrate elimination often fails to produce lasting results. Reducing carbohydrates can quickly lower blood sugar because it removes the source of incoming glucose. However, this does not repair the underlying dysfunction in insulin response. When carbohydrates are reintroduced, even in moderate amounts, the same spikes tend to return. This leads many people to cycle through periods of strict restriction, followed by rebound effects after normal eating resumes. The issue is not lack of discipline, but an unresolved underlying metabolic condition. A key point emphasized is that not only the type of food matters, but also the order in which foods are consumed and what happens after eating. One of the most effective and simple adjustments is to change meal sequencing. Eating vegetables and protein first, and saving starches or carbohydrate-rich foods for last, can significantly alter how glucose enters the bloodstream. When carbohydrates are consumed on an empty stomach, they are digested rapidly, leading to a sharp rise in blood sugar. However, when fiber and protein are consumed beforehand, they create a kind of internal structure within the stomach. This structure slows down the movement of carbohydrates, allowing glucose to enter the bloodstream more gradually, instead of in a sudden surge. Research referenced from Cornell University demonstrated that this simple change in order, without altering calories or total carbohydrate intake, can substantially reduce post-meal glucose spikes. The effect comes entirely from sequencing rather than food removal. The practical application is straightforward. A meal can remain the same, but vegetables and protein are eaten first, followed by starches such as rice or bread. This adjustment alone is described as having an impact comparable to many common interventions people seek elsewhere. The discussion then shifts to specific foods that strengthen this effect. Ground flaxseed is introduced as one example. Whole flaxseed typically passes through the digestive system without full absorption, so it must be ground for nutritional benefit. Once processed this way, it provides soluble fiber that forms a gel-like structure in the digestive tract, similar to the earlier described mesh effect. It also contains plant compounds known as lignans, which may support improved insulin sensitivity. A small amount, such as 1 tablespoon, does not act as a standalone treatment but becomes effective when added to meals that contain carbohydrates. It can reduce the intensity of glucose spikes when mixed into foods like oatmeal, yogurt, or smoothies. Storage is also important, as the natural fats in flaxseed can degrade quickly at room temperature. Keeping it refrigerated after grinding helps preserve its quality. 1 to 2 tablespoons per day is presented as sufficient, and it can be freshly ground using a dedicated grinder or purchased pre-ground in small quantities to ensure freshness. The next food discussed is plain Greek yogurt. Its relevance is less about the food itself and more about timing. Because it is strained, Greek yogurt contains significantly more protein and less carbohydrate compared to standard yogurt. When eaten in the morning, this higher protein intake influences how the body responds to food later in the day. It creates what is referred to as a second meal effect, where the metabolic response to a later meal, such as lunch, becomes more stable. Instead of experiencing sharp rises and falls in blood sugar, the body maintains a more even response due to slower digestion of protein earlier in the day. The recommendation is to choose plain, unsweetened versions, avoiding added sugars that could counteract the intended effect. The flavored yogurt products commonly sold in grocery stores often contain more sugar per serving than a candy bar. This directly undermines the intended benefit. A practical serving suggestion is between 1/2 cup and 1 full cup at breakfast, paired with a small handful of berries for mild sweetness. For those who find plain yogurt difficult to tolerate, a few drops of stevia or a light sprinkle of cinnamon can improve taste without reintroducing sugar. The discussion moves to berries as a replacement rather than an addition. If fruit is already part of the morning routine, a simple substitution can be made. Instead of a banana or a cup of grapes, 1/2 cup of blueberries, blackberries, or raspberries can be used. These berries contain approximately 1/3 of the sugar found in many other fruits. They are also rich in anthocyanins, the pigments responsible for their color. These compounds are associated with improved efficiency in how muscle cells absorb glucose from the bloodstream. The key idea is not removing fruit entirely, but selecting varieties that work more effectively with metabolic function. Frozen berries are considered equally effective and often more affordable throughout the year, removing the need for specialty purchases. The next food introduced is barley, presented as an alternative for those who find it difficult to give up rice or potatoes. Barley contains a soluble fiber known as beta-glucan. Per gram, it provides higher levels of this fiber than oats. This fiber forms a thick, gel-like structure within the digestive system, significantly slowing carbohydrate absorption. Clinical studies show that replacing white rice or potatoes with barley in a single meal can reduce post-meal blood sugar response by up to nearly 1/3 in some cases. Preparation methods are similar to rice. The texture is described as chewy and nutty, making it suitable for soups, side dishes, or cold salads with olive oil and lemon. Quick cooking or pearled barley reduces cooking time to approximately 15 minutes and can be used in most rice-based recipes without major adjustments. The next item is pumpkin seeds, which are noted for their high magnesium content. Unlike expectations of a vegetable, this is a seed-based source. Magnesium plays a required role in the function of insulin receptors. Research has linked low magnesium levels with increased insulin resistance. Many older adults may have reduced levels without being aware of it or undergoing testing. A recommended portion is a small handful, approximately 1/4 cup, consumed raw or dry roasted several times per week. It can be added to salads, soups, or eaten as a replacement for crackers. There is also a note that individuals taking blood pressure medication may want to discuss magnesium intake with a healthcare provider, as it may support blood pressure regulation alongside insulin sensitivity. Apple cider vinegar is introduced next, with emphasis on specific use cases. The active compound is acetic acid. It slows gastric emptying and supports muscle glucose uptake for energy. Its most practical use is in situations where meal control is limited, such as holiday meals, restaurant dining, or desserts. 1 tablespoon, always diluted in a full glass of water, taken approximately 15 minutes before eating, can reduce the severity of a glucose spike. Undiluted consumption is discouraged due to its acidity, which can damage teeth and the throat. Individuals taking blood sugar medication are advised to consult a healthcare provider, as combined effects may lower glucose more rapidly than expected. Using a straw may help reduce enamel exposure when used regularly. True Ceylon cinnamon is then distinguished from cassia cinnamon, which is more commonly sold in stores. Cassia contains compounds that may place strain on the liver when consumed in large daily amounts, while Ceylon cinnamon is considered safer for regular use. Cinnamon contains polyphenols that function in a way similar to insulin, improving receptor sensitivity to glucose. A small amount, approximately 1/4 teaspoon, can be added to coffee, oatmeal, or smoothies, particularly when paired with carbohydrate-containing meals. Before concluding the list, attention is drawn to 3 often overlooked factors. The first is a 10-minute walk after eating. The timing is critical, occurring after meals rather than before. During walking, muscles can absorb glucose directly from the bloodstream with reduced reliance on insulin, functioning as an alternative pathway for glucose clearance. Research from diabetes prevention programs indicates that a short walk within 30 minutes after eating reduces post-meal blood sugar spikes more effectively than longer walks taken at other times of the day. No specialized equipment is required. A 10-minute walk around the block or light movement indoors after the largest meal of the day is sufficient when performed consistently. This concludes the set of strategies presented. If walking outdoors is not possible due to weather conditions, joint limitations, or mobility challenges, standing and performing light household tasks instead of sitting immediately after meals can still provide a partial effect. The key factor is muscle activity itself, which helps draw glucose out of the bloodstream. The next focus is number 9, a step that is rarely discussed: a small protein snack before sleep. Many individuals report a consistent pattern where their highest glucose reading of the day appears first thing in the morning, before any food intake. During sleep, the liver naturally releases stored glucose. When the body remains in a prolonged fasted state overnight, this release can become more pronounced, particularly in individuals with advanced insulin resistance. A small amount of slow-digesting protein before bed can help stabilize this process. Examples include half a cup of plain cottage cheese or a hard-boiled egg. This provides the body with a steady source of fuel throughout the night, reducing reliance on liver glucose output. This approach is not universal. Liver response varies between individuals. It is recommended to test this for approximately 1 week using a glucose meter to observe changes in morning readings. Portion size should remain small, as the intention is stabilization rather than a full meal replacement. It is also noted that combining this snack with pumpkin seeds, previously discussed, creates a simple dual strategy for nighttime support. The 10th and final principle is integration, the combination of all strategies. These adjustments are not required to be implemented all at once, nor permanently from the start. The approach is gradual. One change can be added each week. First meal sequencing, then flaxseed, then post-meal walking, then the bedtime protein snack. As these layers accumulate, blood sugar regulation begins to shift. Instead of fighting against metabolic imbalance, the body begins to function with added support. Many long-term patients achieve results not through sudden transformation, but through steady adoption of small, consistent changes. The most successful outcomes typically come from selecting the easiest adjustment first, maintaining it until it becomes automatic, usually within 1 to 2 weeks, and then adding the next step on top. This stacking method helps ensure long-term stability, preventing the rebound effect often seen with restrictive approaches. A patient referred to as Harold is presented as an example. He is 68 years old, retired after 30 years working as a delivery driver. His fasting blood sugar had been rising for 3 years and had reached approximately 165 by the time of consultation. He wanted to avoid adding another medication, having observed a family history of increasing prescriptions in his brother's case. During the first consultation, his medication was not altered. Instead, his breakfast was changed from toast and jam to Greek yogurt with berries. At dinner, vegetables were consumed first and potatoes last. A 10-minute walk after dinner was introduced, often completed with his dog regardless of weather conditions. White rice was replaced with barley twice per week. On mornings when readings were higher, a hard-boiled egg was added before bed. Within 10 days, his fasting glucose dropped into the 130s. After 4 months under medical supervision, his physician reduced his medication dosage. After 1 year, his results remained stable at follow-up. He did not reduce food intake drastically. He continued eating, but in a way that supported metabolic function rather than disrupting it. The explanation for why these methods work together is then outlined. Meal sequencing and fiber-rich foods slow glucose entry, preventing large spikes. Post-meal movement creates an alternative pathway for glucose uptake that does not rely heavily on insulin. Magnesium and plant compounds in cinnamon support insulin receptor function, improving efficiency. When applied consistently, these mechanisms reinforce one another. Over time, the body becomes more responsive, and glucose regulation improves progressively. A critical warning is then provided. For individuals using insulin or older classes of blood sugar medications such as sulfonylureas, these changes may lower glucose levels rapidly. This can result in excessively low blood sugar if medication is not adjusted accordingly. Any modifications should be monitored by a healthcare provider, who can safely adjust dosage as metabolic health improves. Medication should never be stopped or changed independently. The practical plan begins with 5 steps. At the next meal, vegetables and protein should be consumed first, followed by starch last, even if the meal remains unchanged. The following morning, breakfast should be replaced with plain Greek yogurt and half a cup of berries. After the largest daily meal, a 10-minute walk should be performed, even if it is only around the immediate area. True Ceylon cinnamon should be purchased instead of cassia, and 1/4 teaspoon can be added daily to coffee or oatmeal. If morning glucose levels are elevated, A small protein snack before bed should be tested for 1 week while monitoring results. The approach does not remove preferred foods. It introduces missing elements gradually, allowing the body to regain balance step by step. The final message emphasizes that while these dietary and lifestyle strategies are powerful, many commonly marketed healthy foods can still disrupt blood sugar regulation. A separate discussion is introduced focusing on 5 foods that may unexpectedly cause glucose spikes, encouraging continued learning on the topic. Sources: Is this conversation helpful so far? Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.